everyone, welcome to TNN Special and I'm Arshia Vasudev. In today's special report, we will talk about the panic attacks, its signs and symptoms, and also how we can treat this medically as well as at personal level. And we are talking about this as the corona epidemic is leading the more of attacks in India. Panic attacks are sudden periods of intense fear and discomfort that may include palpitations, sweating, chest pain, shortness of breath, trembling, numbness, or a feeling of impending doom or a losing control. Typically, symptoms reach a peak within 10 minutes of onset and last for roughly 30 minutes. But the duration can vary from seconds to hours. Although they can be extremely distressing, panic attacks themselves are not physically dangerous.
Panic attacks can occur due to several disorders, including panic disorder, social anxiety disorder, stress disorder, substance use disorder, depression, and medical problems. They can either be triggered. Smoking, caffeine, and psychological stress increase the risk of having a panic attack. Before diagnosis, conditions that produce similar symptoms should be ruled out, such as hyperthyroidism, hyperparathyroidism, heart disease, lung disease, drug use, and etc. People with panic attacks often report a fear of dying or heart attack, flashing vision or other visual disturbances, faintness or nausea, numbness throughout the body, shortness of breath, and hyperventilation or loss of body control. Some people also suffer from tunnel vision, mostly due to blood flow leaving the head to more critical parts of the body in defense. These feelings may provoke a strong urge to escape or flee the place where the attack began. A panic attack can result when upregulation by the sympathetic nervous system is not moderated by the parasympathetic nervous system. The most common symptoms include trembling, shortness of breath, heart palpitations, chest pain, hot flashes, cold flashes, burning sensation, sweating, nausea, dizziness, lightheadedness, heavy-headedness, hyperventilation, sensation of choking, difficulty moving, etc. These physical symptoms are interpreted with alarm in people prone to panic attacks. Panic disorder often occurs in early adulthood, although it may appear at any age. People who have repeated persistent attacks or feel severe anxiety about having another attack are said to have panic disorder. Panic disorder can be effectively treated with a variety of interventions, including psychological therapies and medication. Cognitive behavioral therapy has the most complete and longest duration of effect, followed by specific selective serotonin reuptake inhibitors. A 2009 review found positive results from therapy and medication and a much better result when the two were combined. Medication options for panic attacks typically include benzodiazepines and antidepressants. Antidepressants treatment for panic attacks include selective serotonin reuptake inhibitors, serotonin noradrenaline reuptake inhibitors, tricyclic antidepressants, and MAO inhibitors. While the use of drugs in treating panic attacks can be very successful, it is generally recommended that people also be in some form of therapy, such as cognitive behavioral therapy. Drug treatments are usually used throughout the duration of panic attack symptoms and discontinued after the patient has been free of symptoms for at least 6 months.
Things you can try yourself during a panic attack. Do not fight it. Stay where you are, if possible. Breathe slowly and deeply. Remind yourself that the attack will pass. Focus on positive, peaceful, and relaxing images. Remember, it's not life threatening. And that's all for today. For such more special reports, stay tuned with the news now.